to be recorded, no problem. Okay, thank you for joining us. Welcome to you to this Alzheimer's Society and Health Innovation Network webinar. We're going to be talking today about the Alzheimer's Society's innovation programmes, and we've got Michelle and Ella with us today that's going to give us an overview of those programmes for you to understand how you can take part. Or we're also going to show 3 of those innovators that have benefited from those programmes as well, and look at their journey and their technologies that they've improved and brought to the market through those programmes. But if you're not aware of the Health Innovation Networks, let me just tell you a little bit about us. So there are 15 of us across the country. We each work within a regional area to cover the local healthcare ICBs. So myself, I'm Vanessa Linley. I work for the Health Innovation Yorkshire and Humber team. We cover 3 ICB areas. So we cover South Yorkshire, West Yorkshire and Humber, North Yorkshire. And then throughout the rest of the country, there's other health innovation networks that each cover their own areas. And our mission is to spread healthcare innovation at pace and scale. So we improve health and we drive down costs for the healthcare system and the taxpayer, obviously, and we stimulate economic growth as well. If you're an SME on the call today, we identify and support your innovations, and we match the innovations to the service challenges. So we have relationships with stakeholders within the system, and we continually talk to those stakeholders to find out what those service challenges are. And then what we do is we try and form partnerships between our innovators and those stakeholders and bring together these diverse partners to share the learnings and develop innovative approaches. So we spread and adopt that innovation as well, and there's been various programmes throughout the years that we've supported with. I'll come on to some numbers in a little while to show you, but we also support with grant funding and finance as well. So the various grant funding programmes, of which there's obviously funding tied to these programmes that we're talking about today. We'll review those applications to those funding programmes and assist in any way that we can to improve your proposition to those funding programmes. And we also do real world evaluations as well. We do an independent health economic analysis for your innovation and show a value to the healthcare system as well. So over the years, well, every year we release an impact report, and this is the 23-24 numbers. So over the years, there's more than 3.2 million patients that have benefited from our national programmes. And 340,000 hours of healthcare staff capacity has been released through the programmes as well since 2020. And then for our innovators, there's been £2.6 billion worth of investment leverage since 2018 when this programme started. So I'm going to hand over now to Ella and Michelle, and they're going to introduce you to the Alzheimer's Society, and then we'll move on to discussing what those different programmes are, the innovator support programmes over the time. I'm handing over to you, Michelle.
Yeah, I'll just do a bit of an intro and then Ella's going to start with the slides.
Thank you.
Thank you. Thanks. So hi everyone, I'm Michelle Davis, and I'm the Innovation Product Specialist at Alzheimer's Society, working in the innovation team. And I'm joined by my colleague Ella, who's Senior Innovator within the innovation team. Today we're going to outline a bit about our mission and our vision here at Alzheimer's Society and provide some support about the 3 different opportunities we have open, which have all opened this month and due to open this month, some of them. To support dementia innovators, and that'll be before we then open the floor to questions and answers, and to some of our Accelerator alumni partners to share their experiences too. So I'm going to hand over to Ella, who I believe is going to share the slides. If you're okay to share screen, Ella.
You should be able to see those. Can you not see them?
I'll just maximise. Maybe they're up. Yes, they're there. Yeah, thanks. Great.
So just a little bit of context about the Dementia Challenge generally. Someone develops dementia every 3 seconds worldwide, and we're expecting those numbers to grow. So by 2030, there'll be about 78 million people living with dementia globally. And that's not only lots of people living with a really tough condition, they're also navigating a system that isn't built for their needs and for this condition. So 61% of people living with dementia say that they don't currently feel supported by the UK health and social care system. And that all has a financial implication as well. So the stats here, it's estimated to be about £42 billion by 2040, and then 90 billion, by 2040, the cost of dementia. Now, at Alzheimer's Society, our vision is to give help and hope for everyone living with dementia, and we tackle every aspect of that condition. So that includes both policy challenges, funding research, our own work in innovation, and also delivering frontline services for those with dementia and their families as well. An innovation team, our vision is to support entrepreneurs to provide products specifically for everybody at every stage of dementia. And we're going to drive innovation until dementia is no longer a challenge for people. There's a couple of pictures there just to illustrate the breadth of our work. So you may have seen on Channel 4, there was a documentary recently all about experiences with dementia. So you should head over to there, catch up if you haven't seen that. We in the innovation team are leading the Longitude Prize on dementia, and we have had some finalists that were announced this month as well. So it's been a lot of media coverage around that. It was on the One Show. And you might have also seen us on the telly with one of our other Accelerator partners, Sibstar, who recently, this year, got funding on Dragon's Den. You can see the dragons there. So that's just to showcase the sort of variety of different stuff we're doing and where you might have seen some of our work before, if you watch the TV specifically. So this is an overview of, as I said, our vision within the innovation team. There's a couple of different ways that we aim to do that, to bring a product to everybody at every stage of dementia. One of them, as we'd said, is the Accelerator program that we run, and I'll talk a little bit more about our specific programs in a moment. But we also have broader packages of work. As I said, we have the Longitude Prize, but we're also looking to create a culture of innovation in dementia, and to work with systems leaders to unblock some of the bigger challenges. So that includes working with the Health Innovation Network like today, and pushing forward some of the knowledge space around the challenges in the dementia ecosystem to make sure we're tackling the right challenges for those affected by the conditions. Okay, so how, specifically with our programs, how do we provide a product for everyone at every stage of dementia? So there are 3 programs I'm going to focus on right now, and those are the ones which are open for applications this October. There's a couple of ways in which those programs are similar. If you come and work with us at Alzheimer's Society, you benefit not just from the specific package of support on the program, but you also benefit from the wider organisation. So that includes accessing and collaborating with our service colleagues. That might mean that you go to a Dementia Friends session or a Sing for the Brain session, and you get to speak to our colleagues delivering services on the front line and the people affected by dementia that they support. It might mean that you're plugging into our media colleagues. As I said, we've had people on the One Show. We have a fantastic social media team as well. It could mean that you're plugging into some of our policy and influencing work in order to leverage those networks to reach the people who are really at the forefront of changing the dial and making dementia a priority. Or maybe it means that you tap into the unparalleled expert knowledge that our research teams have. As well as accessing the wider organisation, you also benefit from the Innovation Collective, who are a bespoke community of experts around dementia innovation who can support you through one-to-one coaching sessions. We have workshops and other networking events, and they're a real broad church of individuals, those with lived experience, clinicians, data experts, engineers, IP, lawyers, all sorts of different people that have been curated in order to make sure your journey is as smooth as possible. And then alongside that wider community of support from the Innovation Collective and the Alzheimer Society organisation, we also offer bespoke support from our own team in innovation. So that includes stewardship from a senior innovator throughout your time with us, and also access to pitching opportunities and the opportunity to plug into systems conferences in order to access broader networks as well. Those are all the ways that our programs are similar, but this slide is highlighting some of the ways in which our specific programs differ from one another. So I'm going to talk through those a little bit. So the NHS Clinical Entrepreneurship Programme is the first programme that we're running in partnership with the NHS Clinical Entrepreneurship Programme. And that's an established incubator programme that's been running for a long time with the NHS. We're plugging on some support to that programme in order to support those working in the dementia space specifically. So there's some CPD recognised training as part of that, and a whole package of other support that you get if you go onto that programme. That is targeted at both NHS and non-NHS health and social care professionals. So it's really people working sort of in practice who are looking to innovate, but that's quite broad. So you may not self-identify as being in healthcare practice. So if you're a bit confused, come and chat to us and we might be able to tell you if that's the right thing for you. You can go onto that programme at any stage, and for anybody doing anything in the dementia space more broadly. Our other two programmes are delivered in-house for Alzheimer's Society. The Launchpad programme is a new one this year, and that is really aimed at early stage ideas. So anybody who has an idea of something that they might be able to do, but they haven't tested it or validated it, they don't yet have a product or an MVP. If you can come on our programme, we'll help you really test that. So the idea validation bit is a key part of what we're delivering through Launchpad. That's the opportunity to be able to run focus group sessions and really rip apart your ideas, and we'll help you put them back together in order to make sure you've got something which is convincing and will allow you to then go on and get onward investment and make the case for your idea with wider systems. And that is targeted initially at academics, but does have a broad audience. So again, if you are not in the academic community, but you think that you might be able to benefit from that support, come and chat to us and we can help you a little bit more. And then the final programme, which is open this month, is our Accelerator programme, which we've run for a number of years now, and the partners that you'll hear from later on have come through our Accelerator programme. That is primarily an investment package. So unlike the other two programs, you can get up to 100k worth of investment. And that is targeted at people who already own a business or a product that they can then turn into a business. And when they come on the program, we'll help you access new markets and achieve scale with your idea. So really, these are people who are further along than those who are coming onto the Launchpad program. Again, we will accept ideas from anyone tackling anything in the dementia space. But as I said before, we're really looking for go-to-market solutions for that program. And then they also differ in the timelines as well. So the Dementia Innovators programme, one run with the NHS Clinical Entrepreneurship Programme, is a 12-month programme. that will kick off in March and then finish in the following March. Launchpad is only a 4-month program and will kick off in February and then run through until the end of May. And both of those are part-time, so they're designed to be fit around your other work. And that's because of the audiences for those programs. So the Dementia Innovators programs, we said, is targeted towards people in health and social care practice. So they'll be fitting this around some of that work. And then with Launchpad, we are targeting people who might not yet be ready to give up their full-time jobs, but we can help them think through those ideas, see if they've got any merit, and then at the end of that program, maybe think about pursuing this full-time or with a bit more time anyway. And then the Accelerator program is a bit more of a time commitment. We're expecting that people on the Accelerator program will be doing this more or less as a full-time job, and it's an 11-month program rather than a 12-month program. So if you apply for the Accelerator program this October, you won't get onto support from us until May next year, and that's because there's a slightly longer due diligence process for our Accelerator program than for the Launchpad program. So that's a whistle-stop tour of some of the differences. We have loads and loads of information online about these different programs. So if you head over to our website, you can see a breakdown of how they're all different. You can access our handbook, which has some more information specifically about Launchpad and Accelerator. You can sign up to office hour drop-in sessions. We're running clinics every Wednesday afternoon for the next few months, where you can come and talk to us about your goals and ambitions, and we can tell you where you might fit best. And there's also recordings of some information webinars that we ran specifically about the Launchpad and Accelerator program. And there's loads of information on the NHS Clinical Entrepreneurship Program website as well. Just last point, all the applications open this October, but they have slightly different application windows. So the Dementia Innovators program will close at the end of this month. So if you're keen on that one, you need to get moving quickly. And then Launchpad and Accelerator have slightly longer windows. So Launchpad opened for applications yesterday and won't close until January, but we're running that's on a rolling basis. So we'll be awarding places as we go. The Accelerator program doesn't close until the end of November, and the applications will be judged then. Okay.
Thanks, Ella. There's a question in the chat from Lisa. Do they have to be UK/England based applications?
For the Accelerator program, I believe that they do. I can double check exactly what that means, because there's some nuance about where your business is registered versus where you're selling. I believe you need to be registered in the UK in order to get the investment, but you can have sales anywhere globally. Launchpad, there's no geographic specification, although there will be face-to-face sessions as part of the program, so you will be expected to be able to come to at least 3 events which are going to be hosted in England. But if you can get there, then the rest is all remote.
Thank you. Lisa, does that answer everything, all parts of your question? Do you want to jump in and ask anything else?
No, that's great. Thank you.
Good. Okay. Carry on, Ella.
I'll hand over to Michelle now to talk through a little bit more about our portfolio.
Lovely, thanks.
Yeah, we were hoping to allow some time now for questions if there are any more, specifically about the application process and the 3 programs, before we jump into portfolio, or failing that, if there aren't any questions right now, then we can do them afterwards. Just checking the chat.
Yeah, no, Stephen's got one. Stephen says, please can I ask how one obtains an appointment on a Wednesday afternoon session?
The link is on the website, but what I will do is, when I stop sharing my screen and the slides, and the partners share theirs in order to talk through their companies. I'll just put a load of links in the chat for you. I'll put the links to our web pages and to the office hour sessions and our handbook as well. I just I can't share my screen and get the links up right now, but I'll do it in a second.
That's great. Carolyn says, are there any IP related conditions in terms of protecting background IP and who benefits from the foreground IP?
Is that for a specific program or all of them? Because it is a bit different.
Carolyn, feel free to unmic and join the chat. I presume you mean the Accelerator program, don't you?
I probably mean the Accelerator program as opposed to the
Launchpad or the clinical entrepreneur.
Either really, but it's just a general interest in what.
Yeah, I mean, I'm not aware for the Dementia Innovators program, but I can double check that with you. I'll need to speak to the NHS clinical entrepreneurship team. For Accelerator and Launchpad, the applicants hold the IP. So we invest, for Accelerator, we invest in you and your business, but it is your business. And that holds the IP for that you create in partnership with us during the program, but also come into the program with and go out with. So that's pretty straightforward. For Launchpad, we are checking that people coming into the program do own all of the IP for their program, because so obviously some of them coming from academia might be based on a wider piece of research based in a university. So that is one of the conditions for applying, because it's so early stage, that if the idea is based on an existing evidence base or existing work, whoever is applying to the program must own that IP when they come into the program. But you can apply as part of a team and have co-applicants. So there is the opportunity to do that in a collaborative way if the IP is complicated. Anything that's created during the program, so that might be your prototype, a pitch deck, the wider case for your idea, validation of your idea, will again be held by the applicants and their team. We have an IP expert who will be doing clinics throughout Launchpad in order to help people understand what may or may not be defensible within their idea. And we're also supporting people to submit patent applications at the end of the program. So we can help you leave Launchpad with a patent application submitted.
Thank you. That's very helpful.
You're welcome.
Thanks, Ella. Manzo says, how much does Alzheimer's Society invest? What's the range?
It's up to 100K. I think Michelle might talk through a little bit more about the return on investment in a moment, so I don't want to steal her thunder. Michelle's responsible for our portfolio and managing those relationships and those terms of contract. I don't know if you want to come in, Michelle.
Yeah, that's fine. Yeah, we will look to invest up to £100,000, so applicants can apply for up to that amount. We have some apply for smaller amounts, some for maybe 2/3, and then some for nearly the full amount. We don't always offer the exact amount applicants apply for. We will weigh up and look to see what their business plan is and their budget plan, and see whether it aligns with what we feel we should invest in, and also weighing up how many applicants we're bringing forward through the programme at that time, and how many products we're looking to support, and what funds we have, how far they can go, basically. So that'll be considered, and as Ella mentioned, it is a return on investment that we look to seek. At the moment, the return on investment that we do look to seek is through product revenue, percentage of product revenue once that product goes to market. But we are exploring other options for return on investment regarding potentially a return on equity. So at the moment, that's something the society are exploring. We're not there yet, but we're looking into that, and whether that may be more helpful for startups and small businesses in the future as well. And it may not necessarily be just be one of those options. It could be either or a combination. So there are things that we're looking into at the moment. But yeah, in terms of the actual funding amount, applicants can apply for up to £100,000.
Thanks, Michelle. Next question. Does the Accelerator's judging process allow for the applicant to show where they're expecting to be by the March start date?
Yeah, I can come in on that. So that would be down to the applicant really to show where they expect to be by that point. So we would ask applicants to submit an activity plan for their project, what they aim to achieve. Sometimes they will put within their activity plan what they're doing in the run up to trying to secure a place on the programme for May onwards. So this next round will actually be for May onwards for 11 months, as Ella mentioned. So some applicants may log their activity and their own spend up to that point if they've got budget behind them to get started on the project. Some may simply plan for May onwards, with that being the start for when they actually receive the first instalment of funds and kickstart things. So it's entirely up to the applicant. We as a innovation team don't have any requirements about applicants needing to be at a certain point. But what we're looking for, particularly with Accelerator, is that the products are a lot closer to go to market, so that we can try and help where possible within those 11 months to achieve getting that product to market. Or if it's a spin on a product that they may already have at market but may not be dementia specific, then we'll look to try and work with them over that 11 months to make that product more dementia specific by having it tested with people affected by dementia and having that design maybe iterated further depending on the feedback from people. So again, it depends on where the applicant is at when they're applying to the programme.
Great, thanks, Michelle. Does the assessment of applications have any criteria relating to the estimated impact of the resulting product in terms of improved outcomes or reduced inequalities and or a cost to the system, etc.?
Yes, it does. So what we will ask applicants to do is to complete a market analysis template with their application form this time around. And we're looking at that to see whether applicants have considered what else is on the market, what other products are available, where competition may lie for them with their products, to really understand and check if they have explored the market fully and made sure that they're aware of, what is unique about the product that they're looking to bring to market. And for example, what inequalities could it address? How could it relate to changes within the system, and whether it could have cost benefits? Definitely, we are interested in what the outcomes are for that product and the impact on people affected by dementia. That's, one of the key points for us. We're aiming to ensure that there's a product for everyone at every stage of dementia. So, a wide reach if possible. We do appreciate that some products may be more niche in that the reach may not be as wide, but they may have still a really positive impact on the people they do reach. So that will be considered. There's quite a thorough judging process, and we bring in some external experts to support on that, who have an insight of, the innovation ecosystem and the sector in relation to dementia. So yeah, we go through various stages, and we also have people affected by dementia helping within the judging process, and our research network volunteers as well, who are used to scoring research grant applications and looking through those. So a wide range of expertise looking at the applications that come through, but we want to be sure that applicants have really looked at the market and haven't just created or got an idea for a product in silo without exploring that further before applying to the programme.
Just to come in there as well, if you're at a stage in which you've got an idea but maybe you don't know how to build that health economics case to explain the impact that might have on the system, maybe you don't have access to the research or the data, that's one of the things that we can help you through with Launchpad. So we can plug you into some of the best data and researchers in the dementia space, understanding of those knowledge that knowledge, and also how that system, so how your idea might influence broader stakeholders in order to sort of make that narrative, in that case, that pitch. So if you feel like you're not quite there yet, but you've got a good idea, Launchpad might be the right thing for you to be able to build that up before maybe you could apply for something like Accelerator.
Thanks, Ella. That actually might answer partially the next question I'm going to read from the chat. So who could we talk to about a current product that could be applied to dementia patients so that it can be considered for the Innovation Accelerator?
Yeah, you I look like Ella was going to come in, but I'll quickly start.
No, you go.
Ella can jump in. You can contact our team. We're available via our email, innovation@alzheimers.org.uk. But what we would say is do a bit of market analysis firstly, explore what's out there. Is there a product out there similar that already exists for people affected by dementia, or something maybe not so similar but does have that dementia aspect to it? Really explore that and try to understand what your product would offer that would be different and unique, to really see whether it could be beneficial. I would say do a bit of exploratory work with people affected by dementia as well, where possible. So if you can speak to people, whether that may be through forums, through other voluntary organisations as well, and ourselves through local services, to see if this is something that would be beneficial for people. There are lots of products out there that we know could benefit, that aren't dementia specific, but could benefit people affected by dementia. So we certainly wouldn't be put off by people with those type of products applying to the programme. We're open to exploring that further.
Great, thanks, Michelle. Stephen wants to know, if a product gets to market, what are the rules about using the Alzheimer's Society logo and livery in support of the product adoption?
Yeah. So what we will do with partner applicants who are successful, who come on board through our Accelerator programme, we will then work with them to establish whether they need a brand licensing agreement in place. That doesn't automatically come with acceptance onto the programme. That's a separate agreement that we have to put in place. We will look to see where they may need use of the logo, what it may be for, and establish whether there has to be any sort of cost attached to that. It may be a very nominal fee, purely because Alzheimer's Society logo, along with lots of other large organisations, charities, the logo and assets are seen as taxable assets, basically. So we have to ensure that we are demonstrating fair value for use of those assets. And so that's why we have to look at things like brand licensing agreements. If that was a large business that's making a lot of revenue applying to our programme and looking for use of our logo, then there would be some cost attached to that. But again, that's proportionate to the type of revenue that a business may be generating. With a startup, a small business, it would be nominal, very, very nominal. So that's something that we would discuss with applicants on the programme. Ella, I'm not sure if you wanted to jump in.
No, that's fine. I think you covered it.
Great question, Stephen. Hope that answers that for you. Everybody's been very well behaved and posting these questions in the chat. I'm wondering whether it'll just turn into a rammy when people get hungry, but feel free to pop your hands up as well if you want to ask a question, and you can unmute your mics or keep posting in the chat. That's really helpful. And if we do get to the stage where we don't answer anything, we'll collect those questions and answer them afterwards, won't we? Sorry, Ellie, you were going to speak.
Yeah, I was just looking at the clock. I wonder if it's worth moving on. I want to leave enough time for our Accelerator partners, and lots of these questions we can answer if you email us, or I can get into the chat and I can answer them specifically as well. I just would like to leave enough time for the partners, if that's all right.
Yeah, perfect. Yeah. Is it Michelle that's going to do the product portfolio?
It is, yes.
Thanks.
Okay. I'm just minimizing one moment. Okay. So As mentioned, we aim to provide a product for every person at every stage of dementia through our innovation portfolio. In 2018, we started co-designing products for people affected by dementia, and soon after we launched our first innovation product, Lift the Lid, which is a workshop in a box for care homes, and that's to help open up discussions around sex and intimacy needs of those living with dementia in care homes. We developed this in collaboration with an organisation called Good Innovation. To develop this, we worked closely with people affected by dementia, care homes, experts in the field, including CQC, to develop the product, and we actually won a service design award for this product. So I'm just wanting to obviously give you a bit of background as to where we started as an innovation team. Shortly after, we began our Accelerator programme in 2019, and since then we've been investing in a number of partners who have co-created products for people affected by dementia. We've invested in 15 businesses to date, a mix of mainly startups and small businesses with a couple of more established businesses along the way. We worked with our partners at the start of that process to negotiate a return on our investment, and that's to ensure that we can continue to sustain our programmes and continue to invest in products for the future, so that ideally we can aim to reach as many people affected by dementia as possible, and to ensure there is a product for everyone at every stage of dementia. You know, that's our ultimate goal. So to date, we have co-produced 16 products through a mix of Accelerator partners and some of our own innovations. We have 10 products at market currently for people affected by dementia to benefit from. We have reached more than 150,000 people and have sold over 3 million units through our Accelerator partners with those products. Our partners have generated over 4 million in revenue and have secured over 5 million in follow-on funding. So I'm just going to check. I'm just coming back on to see where we're up to on the slides. Okay, thanks, Ella. So the products within our portfolio address a number of challenge areas, as you can see from this slide. So we have prevention. So we have a product called eGym, and I'll touch on that shortly. We have products within the category of maintaining quality of life. So we've got memory lane games, Recro VR, the music project, Feel Good folder, the happiness program, cognitive books. Products that try to compensate for some of that cognitive decline and try to help people continue with that independence, you know, that they would like to live with. So we have Sibstar, Instinctively, and Phylax. We have products that help with reducing anxiety and meeting some of those sensory needs. So we have Pobroll, we have Fidget Widget Toolkit, Hug, and Milbotics. We also have products that are in the food and hydration category, so Jelly Drops and Tasty Spoon, and the product that I mentioned, Lift the Lid, around maintaining choice. So these products tend to fall into 3 broader categories, which are around cognitive stimulation and training, safety and support, and additional support. We're going to look a little bit more at each of these products in detail now. So moving on to our slide on Lift the Lid, I'm just checking, yeah, where we're at. So this is Lift the Lid, as mentioned, our first innovation team co-produced product, which launched in 2018 and is available to purchase through our online shop and through our third-party partners, Relish. Lift the Lid was piloted with 10 care homes and further refined based on the feedback from those care homes. And from the feedback with the likes of CQC and healthcare professionals that were involved. We've presented Lift the Lid to various audience, including CQC conference, social care conferences, and directly to a range of care homes. To date, over 500 Lift the Lids have been sold to care home groups, mental health teams, and other organisations as well. But we believe the reach is far wider than the 500 Lift the Lids that have been sold, because in some cases where care homes have purchased one for use of their care home, then we can establish that many of the residents within that care home have benefited from the use of Lift a Lid amongst the staff team within that care home. So moving on, here we have Fidget Widget Toolkit, which was designed by a dementia advisor in Lancashire in collaboration with the University of Central Lancashire. After two friends here noticed a gap in the market for an adult type fidget product to help calm busy hands and help reduce anxiety. This product's been selling really well. It sells through our online shop and through our partners Relish, and sells into various countries across the world. So it currently sells into America, Canada, Singapore, Europe, Australia, lots of different countries that are benefiting from the Fidget Widget Toolkit at the moment. Next we have Jelly Drops. I'm not going to go into any detail about Jelly Drops because today we've got Lewis, who's the founder of Jelly Drops here, who's going to tell us about Jelly Drops shortly. So I'll leave that with Lewis. We now have a product called SibStar, which is a debit card and app developed by Jane Sibley after she supported her mum with dementia. You may have seen Jane and her husband Marty on Dragon's Den this year. They were successful in securing £125,000 of investment from Dragon's Sarah Davies and Deborah Meaden. They've been doing a lot at the moment, being very active and visible on lots of social media. So you may have seen them across LinkedIn and other channels. Yeah, they're doing great things with the product SibStar, and hope to continue to do more with the financial sector and banking sector. Moving on, we have EarGym. So EarGym is a hearing health app that's meant to help improve your auditory listening skills. It's meant to help improve the brain's ability to focus on the sounds that you want to hear. And this was developed by two founders, Amanda and Andy, who both saw that hearing loss can, and after lots of research, hearing loss can be a major risk factor for dementia. Amanda's parents have both lived with dementia, and Andy, being a DJ, was aware of the damage that can be done through like the likes of loud music, and how this can be obviously a risk factor for dementia. So EarGym is available. It can be downloaded. You can search for it on various like the App Store and Android devices, and they are a health tech startup of the year and were a Longitude Prize finalist as well. Moving on, we have Recro VR. So Recro VR was developed by Sam and Alex. This is a virtual reality reminiscence product, and their aim is to bring virtual reality into care homes so that they can give people a feeling of being outside by using their headset. So they provide personalised content based on people's hobbies, experiences, memories that they may have of certain areas. And it gives people that experience of feeling like they're back in a place that they may have visited many times on holiday. They have partnerships with the National Trust, museums and other sites of interest. They've tested with over 100 people living with dementia in the community and care settings. And over 90% of people living with dementia have used and enjoyed using Recro VR in a recent evaluation study. So that's something you can find out more about if you Google them. We also have cognitive books here. So this was developed by Matt. You may have seen Matt. He's been on BBC News. Matt's developed cognitive books because he noticed his father with dementia, who had a love of reading, was struggling with being able to continue to read books. So Matt wanted to create something a little bit more simple and engaging for people affected by dementia to use. So they have short stories, quotes, short couplets within the books that can be enjoyed by family members and friends with a person living with dementia. Their first book was Looking Back at the Beatles, which is available. And the second book, which they launched in June, was Looking Back at the 1966 World Cup. They have another book at the moment, which they're developing. And yeah, if you look at our web pages, you can read more about them and where they're up to. But I'm sure you'll see Matt again across various channels. So he's very proactive on LinkedIn. Moving on, we have Pobrol. So I'll not really touch too much on Pobrol. I know Ella's moved on, but we have Pat from Pobrol here today to tell you more about Pobrol. So I'll just skip over that one for now. We now have the Feel Good folder, and this was developed by our innovation team, and this is to help encourage people to engage in some regular activity. It's a motivational resource that we developed with input from Sport England. To support inactive people living with dementia to become more active. Can be used independently with the support of a loved one, carer or professional. It's available through our online shop, and we also have some ICBs who've purchased it to support dementia within their local areas, and it's been evaluated, as I mentioned, in conjunction with Sport England. Moving on, we have a product here, which is an interactive activity product for people living in care homes. This was the happiness program, and it's through the power of light that it can help change the lives of people through interactive play experiences. So it's an interactive projector that enables activities and games for care home residents. And this has been developed and taken to market with a partner called Social Ability. 98% of care services experienced improvements in social and physical well-being, and 89% saw improvements in cognitive well-being. We noticed that 1 in 6 care services observed fewer falls, and 1 in 5 saw improvements in nutrition and hydration for the people they support as a result of increased activity levels. And again, you can find out more about that on our web pages. Moving on, and I'll just briefly glide over this one because we have Zeke from Milbotics here today to talk more to us about smart socks. So I won't go into any further detail right now. And next we have Phylax, developed by brothers Jake and Sam, which is an online safety tool. So it's a browser extension that protects people from making repeated or misguided purchases when shopping online. At the moment, that's still in development, so it's not market yet, but they are looking for partners to support with testing. They're also looking for members of the general public and people affected by dementia to help test their product. So you can go online, find out more about Phylax and contact them to get involved in testing. It can currently be accessed for free via a link, and there are new features that they're adding regularly because they're learning from the testing that people are involved in. So that's one to keep a lookout for in future. Moving on, we have Instinctively. This is developed by our partner Else London, another one of our Accelerator programme partners. And this is harnessing the latest technologies to help people living with dementia remain independent through their daily tasks and habits, which may become more difficult to maintain. So it can help with prompting them through technology, so through an app on their phone. It's available for download. They are not at market yet, but again are continuing to do further testing, and they're open to helping evaluate that product further. So you can find out more through scanning the QR code or as again through our web pages about Instinctively if you're interested. And then moving on to our 2 latest current Accelerator partners, and will next year be within our portfolio. We have Tasty Spoon. So this has been developed by the University of Sheffield, and they applied to our Accelerator programme for this year. This product aims to enhance food flavours for people living with dementia. The technological aid uses electrostimulation to enhance flavour in patients with a loss of taste. And it's hoped that the spoon will help combat high levels of malnutrition that people with dementia can experience through their loss of taste. Again, you can find out more about Tasty Spoon through our web pages and by Googling it, because the University of Sheffield also have some information on their pages as well. But that's one to look out for. And our second Accelerator partner of this year at the moment is Memory Lane Games, which was inspired by personal experiences. Bruce and Brian, founders of Memory Lane Games, developed engaging tools to help make interactions with people living with dementia more meaningful. So this product is already at market, but through our programme, they're hoping to use this product with people living with dementia who are in hospitals, by looking at how they can link this in with volunteers who are supporting people with dementia in hospital settings. So Memory Lane Games offer various games that cover hobbies, music, films, sport and more, and it's designed to trigger positive memories and spark conversation. So it's very simple to use. A volunteer can initiate a simple conversation, you know, where did you grow up? Get talking to someone about their hobbies and interests, and they can usually find a game about that on the app. There are specific games about lots of towns across England and other areas too. In 2023, a UK clinical trial showed that 92% of caregivers felt more relaxed using Memory Lane Games. 83% noticed more laughter, 67% felt happier using the app, and 66% of caregivers believed that time spent using the app was worthwhile, and 58% saw an improved communication in the person with dementia. So again, that's one that you can access now and look out for as we continue to develop that, and hope to get that being used within hospital settings with volunteers. That's all from myself with the product portfolio. I'll pass over to Lewis now from Jelly Drops, who hopefully can share his screen to tell us more about Jelly Drops, and then we'll move on to two of the other partners, which I skipped over. Thank you.
Hello. Hi. Sorry, I'm just not really used to Teams, just trying to figure out how to share my slides.
Should be in the top right corner of the screen, Lewis.
Yeah, I'm seeing
an arrow pointing up next to the
screen and
microphone.
window. Am I just sharing the Teams screen here?
Yeah.
Is that working?
Yeah, we can see Jelly Drops. We can see all your slides though. So to the main, yeah, perfect.
Great.
Perfect.
Super. Well, yeah, great to meet everyone, and thank you for the talk so far. It's been fascinating to see all the other products that Alzheimer's have been developing as well. But I'm Lewis. I developed Jelly Drops back in 2018 with my chief research partner, my late grandma Pat. Grandma had dementia for about 7 years, but about 5 years in, her condition started to dramatically decline, and unfortunately, she was rushed to hospital, and the family essentially told to expect the worst. But it wasn't until she arrived at hospital they realised it wasn't really her dementia that had put her there. It's more that she was severely dehydrated. And thankfully, after 24 hours in IV fluid, she was back to her happy self and went on to enjoy a good quality of life for years after. But I was shocked that something as simple, seemingly simple, as not drinking enough could have such a huge impact on her health. So I started to look into the issue further, and unfortunately realised the situation wasn't uncommon. 1 in 5 people in residential care are low intake dehydrated, and the knock-on effects of these are numerous. They can impact cognition. I think it's a 2% reduction in hydration results in a 10% reduction in cognition, so exacerbates care requirements, reduces independence. Also affects falls, UTIs, and a host of other issues that can ultimately lead in hospitalisation and can be fatal. So I wanted to try and help, and I started by speaking with dementia psychologists to understand why many people with dementia struggle with drinking. And it turns out that there's a host of reasons. Many may no longer feel thirst, they may not equate drinking with quenching thirst, may not recognise cups, or lack the dexterity to engage with them. And all this can lead to a general sense of confusion that I could see when going to visit my grandma. Just lack of understanding how to engage with a drink. So to help, I basically spent a month in grandma's care home and observed a lot of these behaviours and challenges around drinking sort of firsthand, such as putting food in the drink or pouring the drink away, and just the fluid nature of drinks means that they're often easily spilt, perhaps falling asleep in your chair. But the biggest problem I found really was many would refuse or not understand when you were trying to support them to drink, and even with all the will in the world and sitting with grandma for hours, it could be very difficult and basically impossible to encourage someone to drink when they don't quite understand what you're trying to support them to do. So with drinking being such an issue, I started to focus on eating habits, and here I found quite a lot more success, especially with finger foods. It was more intuitive, with not needing cutlery, helped reduce distraction. It was also more social. Grandma liked to share her food and would more likely to eat when those around her were eating, and would often like to share her food, and that sort of helped promote sort of appetite. But even still, it could be potentially a bit hit and miss. I guess obviously people have different food preferences. People's tastes change over time, but I found fairly universally that if I would go around the care home, whilst most of the time most of the residents would ignore me, which is fair enough, if I had a box of chocolates, then everyone wanted to be my best friend, and this seemed to be fairly common, and in part is helped by the fact that many people living with dementia develop a sweet tooth, and sweet flavors are one of the most persistent. So yeah, it was great to see that format sort of widely engaged with independently and enthusiastically, and I thought if I could create a solid form of hydration in the format of a treat, then perhaps that could support people living with dementia hydrate themselves. So I made the first prototype, and that was essentially a tray that looked like sweets, the various colors, the bright contrast, they smell nice, they're visually engaging, but they're 95% water. They've got added electrolytes, they're sugar-free without a laxative effect, they're vegan, gluten-free, natural flavors, and they're solid all the way through, so they can be chopped up or bitten. They're not going to pop, not an unexpected release of liquid, and they're ambient stable, so they can be left out on the side. They don't need to be kept in the fridge, and yeah, they're sort of robust from that perspective. So that was the initial concept and prototype, and this is the first time Grandma had ever seen them. So I was actually studying an innovation design course at the time where I developed these, and I took these up to Grandma's care home. If nothing else, it was just a good excuse to go and see a bit more of her. But when she started immediately engaging with the product, recognized it for what it was, passed it around, but soon wanted it back. And in this 10-minute clip, she ate 7 drops, which for me to get her to drink the equivalent, potentially would have taken hours, and I'm sure would have been a lot less enjoyable for Grandma. So it was great to see her engage with this, a fairly basic prototype. But I put this online for a design competition, and within a few weeks, it had been taken, put on Facebook and various other platforms, without me sort of realizing. And it soon had over 100 million views and had gone all around the world. And I was invited on BBC, Sky, and many others. And through that, I had soon had over 50,000 people sort of email wanting to know where we could get it. So this was mid 2018, and we went on, fortunately supported by a number of awards, but most certainly the most impactful was the Alzheimer Society Innovation Accelerator, and it was fantastic timing for us. The first one was in 2019. The product was still at prototype stage, and being able to work with the innovation team sort of really helped us develop it into a market ready product. And by the end of the accelerator program, we were sending it to our first customers, which was fantastic. And it took about 18 months to go from that initial concept to a market ready product, but we've gone on to support hydration for over 80,000 people, and it's been amazing to see so many people enjoy the product as much as Grandma did, and hear all the feedback, not just from people themselves, but also the carers and the peace of mind that can help support. We're primarily based direct to consumer, so they're available online through our website. We're also available for the Alzheimer Society shop, and the product has changed a bit over the last few years. We work very close with our customers, NHS, care homes, and we're now delivered in smaller portion pots, which are easy to have throughout the day. So the idea is little and often throughout the day to support and boost people's water intake. We've also enriched the product with vitamins as well. So now they have B9, B, B12 and B6, which supports cognition, immune system, boosts energy, and they're available in a variety of pack formats, either one-off packs or on subscription. Most people subscribe, and we currently have over 3,000 active subscribers, available in hundreds of care homes and a few NHS trusts as well, and not always just used for people living with dementia. We have many customers now, or some customers now, that have perhaps learning difficulties or autism, and in the NHS wards, perhaps more elderly and frail, as well as supporting the hydration of people living with dementia. So it's been great to see the product also have utility, for a broader range of people. We produced the first 10 million drops, and we were setting up our first factory when we were on the Alzheimer's Society Accelerator program. But we've now moved to much more automated production to keep up with demand and scale our impact, and we're now producing around 2 million drops a month, which is thinking where it started in my student flat, making them by hand. It's incredible to think that's how many drops have been eaten and supporting hydration for people at the moment. But we have a delivery system, and whilst it's geared towards hydration and more recently enriched with vitamins, we know also malnutrition is a huge issue for people living with dementia, and we're looking to develop a product with more nutritional benefits too, which we're currently have been in development with Innovate UK. So looking forward to launching that next year. Thank you. Happy to answer any more questions about time on the accelerator or anything about jelly drops, but appreciate your time.
Lewis, that's fantastic. Thank you so much. What a brilliant product and what a great story. I just wanted to let everybody know Richard's posted a link in the chat to contact form for our innovators today. So that one that he's posted is particularly for jelly drops. If you want to talk more to Lewis, you want more information, you can leave your details on that form and we'll put you in contact with Lewis. And Richard will post these links as we go through the innovators. But fabulous, Lewis. There's a question in the chat for you. Fantastic product, Caroline says. Absolutely agreed. Congratulations. Is it deployed in hospitals or just care homes?
So it's available in a few NHS trusts at the moment. It is in care homes, but it's also a significant portion of people in their own homes. So it's often loved ones of family members living with dementia that are purchasing it. So either taking it into a care home for them to enjoy there, or in their own home and supporting them in their own home for longer. We have care homes buying it directly as part of their service, so it works in sort of all different ways at the moment. But it's available in care homes in the NHS and in available for people to buy directly.
Great, thanks, Lewis. Is there a favourite colour yet, Lewis? You know how everybody has the favourite Smartie colour. Have you had feedback on it? Which is
I think definitely the berry flavours go down the best. We used to have a berry pack and a citrus pack, and the berry pack outsold the citrus sort of 10 to 1. So the sort of the red flavours, and I think blackcurrant, and also I think in the US. So I didn't mention we're available in the US and the UK as well. US and Canada as well. And I think the blackcurrant there is often sort of cited as the favourite, which we were surprised about, because I didn't think blackcurrant was such a flavour in the US. People sort of thought ahead of going there that perhaps people wouldn't be used to blackcurrant, but it seems like people like it.
Yeah, it's maybe a novelty. Julie, you've got your hand up.
Yeah, I was just going to ask. I'm Julie Westlake. I'm a commissioning officer in St Helens, and I was just wondering, we have provider forums. And I was wondering whether I could possibly invite you along to do a little bit of a Teams presentation on this, particularly I'm sure our other, like commissioners for extra care, domiciliary care would really appreciate it, but I'm the commissioner for care homes, so I'd really value your time if I could make
Julie,
contact
that's a fantastic
with you.
Opportunity. Thank you for doing that. And I'll take a note of your name if you want to pop your details on Richard's form as well, and we'll make sure that you get in touch with Lewis. We put you together with Lewis. Thank you. That's really kind.
Thank you.
Yeah, that'd be amazing. Thank you.
Thank you.
Any other questions for Lewis about his product or about his journey with Alzheimer's Society Innovator Programme? Hand back to you, Michelle or Ella.
Thank you. Thanks, Lewis. Next, we have Zeke, who has just joined us. And apologies about that, Zeke. It appears Zeke didn't receive the joining link when he registered, so I've just quickly sent him and he's just joined in the nick of time. So Zeke's here to tell us a little bit about Millbotics and smart socks. So I'll hand over to you now, Zeke.
Thank you, Michelle. Good to be here. So I'm the founder of Millbotics. We're an award-winning health technology company based in Bristol, and we're developing a really exciting product called Smart Socks, which is a pair of AI-enabled socks. We have been through the Accelerator program. Actually, the seed for our product came about through a personal experience that I had with my great-grandmother, who's shown on the left. So her name was Kath. She was diagnosed with dementia around 12 years ago. Leading up to that diagnosis, she became increasingly agitated and aggressive. And eventually her behaviour became so challenging that my family could no longer meet her care needs, and she was admitted into a care home. It was an incredibly traumatic experience for her. She found herself in this unfamiliar environment, surrounded by strangers, detached from family, and she became even more agitated, even more aggressive, and spent the last year of her life in misery. At the time I was working as an engineer in the defence sector, I saw what was happening and I decided to try and utilise my engineering know-how to provide some kind of technological solution that could help family carers in particular better manage behavioural symptoms of dementia. I embarked on a 5-year research project at the Bristol Robotics Laboratory, which is the UK's largest robotics research lab. And through that project, I really focused on 2 challenges. Number one, can we get an older person with dementia to engage with a wearable device? What does it take to do that? Number two, can we use that wearable device to collect physiological data that might indicate when that person's in distress, even when they're unable to communicate that to a carer? So this piece of research was completed in 2021. It was very successful. I pitched it to Alzheimer Society, and they decided to invest to fund the commercialization of this research into a product. So that commercialization journey then started in 2022. We've gone on to win a number of Innovate UK grants. I think we're now at 4. We've also raised some equity investment from investors to get this product to market, and we've made a lot of progress over that period. So let me tell you a little bit about where we're at the moment. This is our team, rather this is our management team. I'm not going to go through everybody, but Dr. Kumi Pillay is amazing. He's a neuropsychiatrist. He spent 20 years managing behavioural and psychological symptoms of dementia through his clinical practice. So really, really valuable resource within the team. And this is our product, Smart Socks. So what we do with the socks is to detect the physiological precursors of a behavioural episode through various different sensors, textile sensors that are knitted into the sock. And we're looking specifically for a fight or flight response, which would indicate that the person is in a state of distress and anxiety. And that might not necessarily be visible in the person, and they might not be able to communicate that due to communication difficulties. Specifically, we measure pulse rate and pulse rate variability, skin temperature, electrodermal activity, which is a sweat response. So we actually measure activation of the sweat glands at the arch of the foot, and this is a very effective way of understanding when somebody's aroused, physiologically aroused. We also have motion sensors in the socks, so we can detect things like repetitive and agitated movements, and also how active the person is during the day and whether they're exhibiting any pacing behaviours. The socks are machine washable, currently at 30 degrees C, but we're aiming for 70 degrees C for infection control reasons. Fully wireless using Wi-Fi, so they will piggyback on the Wi-Fi network that's available within the care setting. And the data that we collect from the socks is sent to our cloud, which is called Physiometrics, and we have some really advanced algorithms that run there in the cloud and provide an alert to the carer on a smartphone application to indicate when that person who's wearing the socks is in a state of distress and needs support. Some of the reasons for socks. So as part of that initial research project, I was taking different wearable devices into care homes, wrist-worn devices that go around the chest and around the waist, and trying to understand why these devices weren't being more widely used. And what I was finding through talking to frontline care workers is that these devices are often in very visible locations. The person with dementia might find them uncomfortable, they may pick at them, they tend to get fidgeted with and often removed. In extreme cases, they end up flushed down the toilet. The fact that we've chosen the foot means that it's out of sight, out of mind. It's also more difficult for the person to reach down and remove that sock, even if they wanted to. So it's a wearable that's much more likely to remain on the person. And a lot of older people do tend to wear socks. I'm sure everyone on this call is aware of that, tend to get colder feet. So actually a sock is a really good choice of wearable for this demographic. The arch of the foot also has one of the highest densities of sweat glands on the human body. So the fact that you get sweaty feet makes it a great location for measuring when somebody's stressed through this parameter called electrodermal activity. So we're much more accurate than an equivalent wristband as well. I'm not going to spend too much time on this slide, but just to say that we're developing Smart Socks as a family of products, each targeting different customers. So the product that we're launching with later this year is called Smart Socks Discovery, and it's designed for use within research. Eventually, we want to develop a medical device, a medical version of Smart Socks that can be sold within healthcare settings, particularly acute settings like hospitals. There is a version called Smart Socks Comfort as well, which we're targeting a launch of mid next year. And this is designed for use within social care settings. And we're currently in trials with this product and share a little bit of some of the evidence that we've collected so far with that product. So this is Smart Socks Comfort, the social care product. It's a distress management system for people who find communication difficult and who exhibit dysregulation of behavior due to distress. Typically people with dementia, but it can also include people with severe autism, learning disabilities, acquired brain injuries. There are a number of people that this product can help. And the idea is that by forewarning carers, we can enable them to intervene more effectively and in a more timely manner to nip an escalation of behavior in the bud, and also provide appropriate support and improve the person's well-being because they're not in pain or anxious for as long. This is some of the software within the system, and there are actually two different screenshots here. If we look at the one on the top, this shows a resident dashboard. So this is the software for use within a care home. The residents within the care home can be grouped into different areas, and what we see around each resident is a border which indicates their level of need. And this is a traffic light system. It's based on the amount of time that that person has been in a state of distress as per recognised by the SOCs, and that distress hasn't been managed for. So we'll see somebody move through this traffic light system the longer they're left unattended. Moving on to the bottom screenshot. So this is if you click on one of the wearer's profiles, you'll then see different information about that person, which is pertinent to understanding what their triggers are, what kind of support is successful for them, and any recent alerts that have been registered in the system. And we can then get a bit more of a detailed view to understand when the alerts occurred, what the trigger was for those episodes, what kind of behavior was exhibited, what kind of support was provided, and whether or not that support was successful. So we're building essentially a digital ABC chart to really develop an understanding of what it is that's distressing that person and how best to support them in place. In terms of real-world evidence, we've run a couple of trials with Cranfield University across a dementia unit and a learning disability organisation. And we found that a sock was much better tolerated than a wristband, as we expected. A surprising result was that the management of pain improved significantly within a care home setting. And this had a knock-on effect on the health score. So general well-being significantly improved because pain was being better managed, pain treatment was optimized. We also found that the output of our algorithm detecting distress correlated very well with what carers were seeing on the ground. So it gives us a big stamp of approval that what we're doing is working and that it's delivering real benefits for people affected by dementia. And we have a number of trials up and coming within care homes, within hospital settings, and also within the community. So we're really looking at how we can broaden the applications of this technology and this product to help as many people as possible. A few testimonials here, which I will skip over. I'm going to give a little bit of an introduction to the medical device. So this is the product that we're just about to start developing, and we've been seeking views and understanding how this product can help people for several months. At the moment with Comfort, we're very much focused on how we can improve the management of distress, and we feel that this can help improve well-being, but also aid staff retention and save costs for social care. When we look at healthcare, we see that that there is a real struggle to provide care for the number of people that need to receive it. And as a result, there's a big push to provide care within the community through virtual wards. We see Smart Socks as a frictionless health monitoring solution that can enable that data to be collected with very minimal support provided from clinicians, and that they can then remotely understand what's going on with that person and put in place appropriate measures to maintain the independence of people and provide really good care. Similarly, there's a huge issue with falls, as we all know. The fact that we have sensors in the socks that can measure motion is really important for identifying the trajectory of that person's mobility and whether it's deteriorating over time. We plan to embed pressure sensors in the soles of the socks, and this will enable us to measure gait and balance much more effectively. And again, pick up the risk that somebody is going to fall before that actually happens, so that preventative measures can be put in place. And that's really what this medical device product is about. So, besides developing it as a medical device, we're looking at introducing cellular connectivity so that we can allow the person wearing the socks to use them wherever they are, even if they're going out to the shops, and continue to collect that really key data, providing a much more complete falls offering, adding in blood oxygen saturation measurement, GPS, which is something that keeps getting requested, extending the battery life and increasing the wash temperature. So really exciting, lots of possibilities with the product. We're at a fairly advanced stage, not quite at market yet, but we're getting there and really excited about future opportunities to help people, including people affected by dementia.
Thanks, Zeke. The story is wonderful. The product's even better. Fantastic. Thank you.
Appreciate it.
There's a question in the chat. I think it's directed at you, not the previous innovator. Afra says, I can definitely see how this product could be of use for other groups too. For example, people with learning disabilities. Is this something you're exploring or planning to explore?
It is indeed, yeah. And as I said, we did run a trial in a learning disability organisation, and we saw real benefits there. So certainly broadening that out, I think the ability to collect data in a way that is non-intrusive and doesn't cause the person any distress, any discomfort, is a huge opportunity. And supporting with the management of behaviour as well is really key.
Right, thanks, Zeke. Any more questions? Unmute your mics if you want to ask Zeke anything. Alternatively, Richard's posted a link to a form in the chat again if you want to get in contact with Zeke, and we can make that happen for you as well. So if there's no more questions, thanks, Zeke. I'll pass back to Michelle.
Thank you very much.
Thanks, Zeke. Thanks, Vanessa. We have Pat O'Brien next, who's here to talk to us about PobRoll. Pat was one of our Accelerator partners last year. I'll ask Pat to share her screen, if that's okay, and talk through the slides for 10-15 minutes. And then after that, we should have some time before we finish for any questions for all three partners, if anyone has any final thoughts, things they'd like to ask. Thanks,
okay,
Pat.
that hasn't worked very well because I've just shared my screen and I'm not where I want to be. Let me just see. There we go.
Okay, thanks.
Can everyone see?
Yeah.
Perfect, Pat. Perfect.
Okay, can you see my notes as well now?
Yes.
Okay, I shall just ring it then. I shall go back to not showing presenter view. Hang on. Or I would if I could do that, but I don't know how to do that.
Don't worry,
share
Pat.
and start again?
Okay, let's start again. All right, we'll just ring it. So my name's Pat O'Brien. I'm a physiotherapist based down in Cornwall, and for the last 20 years I've been working in the care and nursing home sector, and I have a wealth of experience working with people with dementia, often at the very end of their life, often when they're at their most frail. And I have to say, I've been absolutely appalled at the way in the 21st century we seem unable to wash somebody with any level of dignity or respect. So I decided a couple of years ago to try to do something about this. And it all started with a packet of biscuits, basically, and a couple of tea towels that I thought I would play around with to see if I could make a better way for people with dementia to have a personal, intimate wash. So where people have dementia, intimate care can be one of those daily routines that provokes a real panic reaction. And Zeke was just talking about the distress, as did Lewis, about the distress their relatives felt in care homes. It isn't necessary if we do this in a much kinder way, but we don't really provide our care staff with any resources to do that. The very fact that someone's being undressed, getting cold, feeling exposed and embarrassed tends to trigger that fight or flight response. So I literally thought, okay, here we go. This is my original idea. It's a packet of crispy slices and a couple of tea towels. I thought, let's make the crispy slices that person. How can we keep them warm? How can we keep them covered? How can we stop this daily assault on their dignity that is so distressing for both them and their families? So I will whiz through these little slides. You may not have a clue what I'm doing here, but that's a person laying on their side, rolling over a rolled up sheet. That's the person rolling back over it. That's the person on their edge again. And I'm whizzing through, that's a person nicely wrapped up within a nice warm comfy layer of pod roll, and here's the finished product. This is John. He's an elderly gentleman with dementia who gets very upset when his wife attempts to wash him. This has caused the family no end of distress. Every day the wife is worried about what's John going to do when he has to have his wash. Is he going to get anxious? Is he going to get upset? With the pod roll, he's kept warm, comfortable, cocooned, snugly held, wrapped up, facing away from the carer's gaze. In the care homes where this has been trialled, it has significantly decreased the numbers of staff needed to provide somebody with intimate care where they are known to have behaviours which are very easily triggered and which escalate. The care capacity was significantly, or the care capacity within the home was increased once we had the pod roll in place, and individual episodes where we were having to use 4-to-1 carers could be reduced to 2 people. So significant saving for the home. But more importantly than that, it's how this feels from the person's perspective. You have somebody who is not cold, not getting embarrassed, not feeling exposed. They're very warm, and often my experience has shown me that they actually just drift off to sleep. And the personal washing can be done very, very discreetly by just opening a flap, as the 2 folds of the pod roll can be left to fall open at the end. So it's a very simple product. It is addressing an issue which nobody really wants to talk about, because intimate care, continence care, it isn't something that grabs any headlines, but it's a very real problem. It's very real for people in their own homes, and it's very real in care homes where the behaviours that are escalating are now one of the main focuses of a carer's day. And not many carers have signed up to do that role because they want to be containing people's aggression and using conflict management skills. So this gives the carers a really easy option. It's very easy to use. You don't have to go on any courses to learn any techniques. You just hold it snugly around the person, so it's a physical barrier between you and them. So if you have somebody who is actually hitting out, they cannot touch you. You're protected. But more importantly, they tend not to try to hit out. Once or twice within the pod roll, the behaviours have been shown just to calm right down. And the carers have almost been borderline angry with me. They've said, Pat, why haven't you had this before? It's so easy. And I just hold my hands up and say, yeah, I'm trying, I'm getting there, you know, one step at a time. I'm a long way from the successful journey of our other 2 presenters. I'm very much at the beginning of this journey. I'm also very much a one-woman band, so I've got a lot to learn, and I might be picking both Lewis's and Zeke's brains if I can going forwards to see what my next steps might be. As I've actually failed to even do a presenter view on my presentation, I obviously could do with having a fair few more skills with my social media and my publicising of my product. I've ultimately called this little presentation A Better Way. It's a dignified way. It provides comfort and warmth. Added bonus is that the bed stays dry. You don't have to change the bed linen. So within care homes, every time anyone had a bath on the bed, you'd have a pile of wet towels in the corner. The care staff would be soaked. The person would be distressed. It was all so chaotic. But with the pod roller, you can slow the whole thing down. Everyone stays safe. There's no need to change the bed linen. You actually get a much higher standard of cleanliness and skincare because you're not rushing to get that person through this uncomfortable routine. The behaviours which challenge come right down, and everybody can actually carry out this task in a calm and planned manner. So the care staff can relax, they don't have to come to work stressed, and the person at the centre of all of this, which is the person with dementia, doesn't have to suffer this terrible assault every day just to have their levels of hygiene kept to a normal standard. So from the care staff's point of view, they've told me it's the best thing ever. It maintains the client's dignity while doing the personal care. It saves time because they don't have to strip the bed, and the client's family are very pleased with this product. It's easy to use, following the instructions. Absolutely fantastic product. And that's the end of my little presentation. My email address is there. Very happy to have conversations with anybody who might be interested in having a trial of the pod roll within their services. And I'm just at the beginning of this journey of trying to spread the word, and hopefully this meeting will be one of those activities which helps me do that.
Thank you. That was wonderful. Just for my benefit, what stage are you at? Have you had any sales yet? Are you at testing stage? Have you got case studies?
I'm not at the testing stage. I've got them all on the shelf ready to go. I have a manufacturer down here in Cornwall, so it's all a very small carbon footprint. It's manufactured in the UK and made in the UK. I have a website up and running which is functioning, so I can take online sales. I've had some sales. I haven't had a lot of sales yet. I've mostly been spreading the word via going to care shows and liaising with health professionals, trying to find out via the occupational therapy teams how we can engage with institutions to crack all the various barriers and obstacles there are to including a new product into, for example, the NHS or social care. So I'm kind of at the discussion stages with regards to institutions, but I'm at the sales stage with regard to individuals. The people who see the worth of this immediately are people with family members that are struggling. You know, this solves your issue tonight. It's not anything you have to learn about. It's a very practical solution to a very real problem. So it's very immediately of worth to the public person who's looking after their mother or their father or their partner. With regards to institutions, that's where there's a lot of resistance to anything new, in my experience. And often it's the laundry services which are a little bit of a barrier to me, simply because they have external laundry services and products get lost. Nothing to do with whether it can be washed or not, just the actual process, whichever what the hospital's using.
Yeah, interesting. Thank you. And yes, I mean, I think you're the newest innovator out of the three that have been showcased today. So I'm sure you will go on the journey that the other two have got, and you'll be hugely successful with this. Are you working with any of the health innovation networks?
No, it's just me and the Alzheimer's team.
Okay. Well, I'll certainly link in with you and see where we can help, maybe an innovation showcase or look at your value proposition as well. I hear you about the marketing thing. So we'll see what we can do with you for that. Yeah, there is a question. Sorry, go on.
I was going to say I need to talk to Zeke, because I absolutely need to make the same cases he's making about, reducing behaviours and the impact of cost to care homes. That's my next challenge really is to actually make that costing far more evident to people.
Yes, yeah, very important. There is a question in the chat. Bear with me, I need to scroll back up. From Carolyn. It's a really great innovation. Would be great to know if you see there being a need in hospitals. So I suppose as opposed to care homes, I think Carolyn means. Tell me if I'm wrong, Carolyn.
That's correct.
Yeah, no, absolutely. To be honest, my drive to make this product wasn't initially specific to dementia clients. It was mostly to just give anyone who's bedbound some dignity and respect. So it can be applied across the spectrum of healthcare, from your acute spinal injuries wards to your disabled wards to the very elderly and frail wards. It can be applied to anybody who needs to have a bath while they're on the bed. With the hospital system, the barrier is literally just the policies and procedures and the laundry processes, and it's just very, the product itself could absolutely go there. It's just how do you get in and who do you talk to?
Yeah, and I think for the benefit of this conversation as well, I know we'll have people on the call today that are looking at these and thinking, oh, yes, we could use this. But also what's helpful for these innovators sometimes is letting them know what you see the barrier being as well. That can be a really helpful conversation. So if anybody has recognised any issues with some of the things that we've presented today, also get in touch with our innovators and let them know that, because that can really help them on their journey as well. Does anybody have any more questions? Pat, you were going to say something.
Yeah, I was just going to say, one of my issues has been that hospitals tend to want single patient use equipment and is very happy to throw equipment away, which seems crazy given that we're all supposed to be aware of climate change and the ecology and making sure products are robust. So I've made something that is robust, that will last for years, that can be used generically across your whole client base. But as I say, I'm being told, well, we want single patient use because we can't wash it. We want it to be thrown away or go home with the patient. So that's something that I've had to struggle with.
Yeah, so it'd be helpful to understand that conversation. And obviously there's a huge net zero implication there as well. So quantifying that for you would be helpful, wouldn't it?
Definitely, definitely. And that's possibly my difficulty, is that, you know, I'm somebody at the end of their career, really. Somebody much younger than me should have invented this 50 years ago. It's a little bit crazy. It's something so basic. It should be there. It's a very obvious product. But yeah, I think I need to pick Zeke and Lewis's brains about how to get this business to the next stage.
Definitely. Thank you. Any more questions? Just scroll down the chat and make sure I've not missed anything, Pat. Product rather than any question. Yeah, main barrier for the NHS and social care is likely to be cost from AFRA. Yes, it always is, isn't it? Implementing hospitals, another barrier will be the additional cost, but could be a business case if you can show that it saves cost by saving time and helping staff retention, for example. It'd be good to talk about that. So there's another email address there that we can put you in touch with as well. So lots of people wanting to help, Pat.
Thank you. Much appreciated.
Thank you. Thanks. Pass you back to Michelle and Ella.
I think we're just saying thank yous and goodbyes to everybody.
Oh, well, okay. If we're at that stage already, we're quite early. We're quite early. So that's brilliant. Thank you very, very much for coming along today and helping our innovators and listening about the Accelerator programs. Just give it a couple of minutes for anybody to post any more conversations, any more questions in the chat, about the previous innovator programs. If you want to ask any more questions, Richard did post a link to all 3 innovators for us to collect your questions as well. I hope you found it a really good session today. We're going to give you extra time back for lunch, early lunch and coffee.